Hello viewers, how are you doing? This is Friedman Praise Melody. On this channel we talk about health related issues. So today we are going to be talking about portal hypertension. It is a type of hypertension. You've heard about hypertension before, or you are suffering from what we call hypertension. So this particular topic on hypertension will be very interesting for you to know. So make sure you watch this video to the very end. Alright. Portal hypertension is one of the most serious complications of advanced liver disease. We talked about cirrhosis yesterday. Here we say is the scarring of the liver. This is like a complication, one of the complications of cirrhosis, which is the scarring of the liver. Portal hypertension is elevated blood pressure in your portal vein and the smaller veins that branch off from it. Your portal venous system. The portal venous system drains blood from your stomach, your intestine, your pancreas, and the spleen into the liver through the portal vein. Your liver filters this blood and then send it back to your heart and into the general circulation of your body. So when you have a portal hypertension, how do you know this is a very serious case? Complication of a portal hypertension can be life-threatening, especially where there is a internal bleeding. Not everyone will have this complication or like this internal bleeding, but the risks increase as portal hypertension increase. The greater the pressure, the more the enlarge of your veins, and this will likely lead to rupturing of these portal veins. The portal hypertension is the most common cause of hospitalization and death in people with cirrhosis. Cirrhosis we discussed yesterday. Portal hypertension is one of the complications of it. So when you see that what we are discussing is like interwoven and linking to themselves. So when you have a portal hypertension, what are the symptoms you are going to be seeing? One of the symptoms you might see is you might start vomiting blood. There will be blood in your stool. You will have bloated stomach with rapid weight gain. You have a swelling in your legs and feet. There is edema. You still have like something like mental confusion. You are most at times disoriented. You are not yourself. You are not organized. So what are the potential complications of portal hypertension? When you have portal hypertension, what can be the complication of it? You will have what we call ascites. In the previous video, like the 3 days back, we've talked about ascites. So if you have not watched all those videos, you can just go back to our video, start watching them. You will learn from them very well. One of the complications is ascites, and other is a low blood oxygen, like the circulation of oxygen in your body will reduce. In some people, portal hypertension can cause the blood vessel in their lungs to dilate. This interferes with their lungs' ability to transfer oxygen to their blood. This will result to what we call hypoxemia, that is a low blood oxygen level. Another complication of it you will be seeing is a kidney failure, where there is dilated blood vessel resulting from portal hypertension. It can cause other blood vessel in your body to narrow. If this happens in your kidney, it can cause kidney failure by restricting your blood supply. This is a rare complication though, but it happens sometimes. Another complication you might see there is a mild cognitive impairment. Mild cognitive impairment, like your body adapts to portal hypertension by creating new blood vessels that pass or bypass your liver. But when the blood that bypass your liver, it doesn't get filtered as it is supposed to be filtered. Toxins accumulate in your blood and eventually affect your mental functions. You may have a temporary bouts of confusion and disorientation. And the last complication here is blood clot, like thrombosis in the portal venous system can obstruct blood flow into the liver, through the liver or out of the liver. Many things can cause this including hereditary, like this blood clot, this thrombosis. Many things can cause it, including inherited disease. But portal hypertension is one of it that can cause it for you, and it's a complication of a portal hypertension. How do you know you have a portal hypertension? You may have an enlarged spleen, gastrointestinal bleeding, ascites, then cirrhosis, sign of mild cognitive impairment as we have talked, low blood cell count, easy bleeding, and bruising. Maybe when you get just cut a little, much blood and all that. Management and treatment, I don't. For advanced cases we discuss like this, I don't normally recommend you treat at home. So when you start feeling some of those things we've talked about, what do you have to do? You just have to go straight to the hospital. We have able men, doctors in the hospital that can check you out and give you the proper treatment you need. So one thing you have to notice when you start noticing, when you start noticing blood in your vomit, rush to the hospital. Blood in your stool, rush to the hospital. Swelling in your legs and feet, rush to the hospital. That is edema. You have mental confusion for no reason. You are disoriented for no reason. Rush to the hospital to get yourself checked out. What we do here is to give you the basic knowledge of it, so that when you start having or feeling those signs, you will not be ignorant of it. You will take yourself straight to the hospital to get treated, so that your life will be preserved and you will enjoy life as it is supposed to be. Understand? So if you know this video has been helpful to you, you've learned anything from this video, it's better you like and subscribe to this channel. If you have not touched that plus sign you are seeing there, touch it and subscribe to this channel, because we bring you latest information on health every day that will help your life.